The ASBMT Clinical Case Forum will not only make it easier, but also improve our ability to collaborate with colleagues. We've entered into a technological age. I remember the days when you phoned a colleague and waited for them to phone you back. Now, 24 hours a day, just by logging in, any care provider, any trainee, any faculty member can engage in a conversation. Time will not be a limiting factor for us working together. I'd like to tell you about one of the difficult cases that I've been struggling with and that I'm going to post on the forum to see what my collaborators around the world may think. This is a 62-year-old gentleman with acute leukemia. And early post-transplant, he developed diffuse alveolar hemorrhage. We treated him with high-dose steroids, didn't find any infections, and even gave him some etanercept. But then he hemorrhaged again, and I'm really wondering if this is related to a side effect, which is pretty unusual and I've never seen before, related to one of the medications that we use to help prevent graft versus host disease. I'm really looking forward to seeing what my colleagues think. Going forward, I want to make really absolutely sure that I've done everything possible that this doesn't happen for my patient again. I've used other online forums to connect with colleagues, and I found it incredibly useful. Sometimes there are colleagues that you wouldn't have thought about connecting or perhaps having an interest in a particular area that you're inquiring about, and all of a sudden others are engaging in the conversation. It's really an easy way to develop connections and hopefully even develop some research questions that will drive our field forward through this type of online forum. I've even seen a change in how I interact with colleagues, particularly when I see them at meetings. For one example, on a platform that I use, I had discussed a case with a colleague not at my institution, and turns out a colleague that I had not met before. Then when you run into that colleague at a meeting, it's like you know them, and it opens up a whole other type of conversation. So my world has gotten a lot larger by using these types of online platforms, and I hope your world will enlarge as well. We all struggle with different cases, and just explaining to someone what you're struggling with and how they might approach a patient really provides some assurance that you've thought of the differential and thought of the different types of therapies that might be employed. I also think we'll use it as a valuable educational tool. Many trainees from around the world are interested in improving their own practice and learning from us, maybe older mentors. The other thing is that I believe that even as older mentors must constantly work to improve our own education and the quality of our care. Increasingly, we're being asked to demonstrate quality, and I believe that this will form a basis and a communal platform for all of us to do that. I believe the online forum will make it easier to collaborate with colleagues. Often we try to get people together on a conference call, and you really can't show them the images. Maybe the patient's lungs with pulmonary problems, or the skin, you're not understanding what's causing this rash. This is a multimedia platform that allows us to quickly look at a variety of images, ask questions back and forth to each other at any time, day or night, and will bring in variety of collaborators that are not only physicians, but multiple members of care teams. And I think that it really opens it up to worldwide collaboration instead of single or a few institutions trying to work together. This is a whole new world of collaboration.